straight on into our conversation this morning. We are starting things off with someone to talk to us about mixing health with artificial intelligence, or AI. You know, we've been hearing quite a lot about the strides being made in AI around the world, and there is one doctor here in Trinidad and Tobago who is seeking to integrate AI with health services. So we're going to hear a bit more, and we're going to now connect with Dr. NAVI MURADALI, who is a doctor and dental surgeon. So a special good morning to you, Dr. MURADALI. How are you doing this morning?
Good morning. Thank you very much, Kandace, for having me on Tobago Updates. Good morning to the people of Tobago.
Certainly. So now, first of all, just tell us a little bit about who you are. And before we get into this whole talk about artificial intelligence and so on, and some of the things that you're doing there.
Well, I'm a medical doctor by profession, and I've jumped into the digital wellness field. So what we do is we build digital wellness apps for customers, mostly people who are supplying employee wellness programs for their employees at work. So I've had a lot of experience in medicine, and I've dived across to the tech world, and now it's an exciting world with AI.
Like I said, has been taking over the world by storm, and it's improving rapidly. It's growing so fast, like it's hard to keep up. But you're here, I mean, in Trinidad and Tobago, we haven't quite caught into it as much as yet, but you're hoping to integrate it into some of our healthcare systems. So tell me a little bit about what you've been trying to do.
Correct. So, Kandace, basically, everyone has the potential to use AI on their phones. Everyone has a smartphone. I think you could agree that everyone, Trinidad and Tobago, even in the wider Caribbean, we all have smartphones. We have internet, because everyone is using WhatsApp at this point in time. So what we've decided to do is partner with the Human Resource Management Association of Trinidad and Tobago, HRMAT. And what HRMAT does is that they have members in the companies that provide employee wellness programs for these employees. And what we have tried to do is to incorporate the digital wellness app. So you basically give an app to the employees, and they would have a list of well-curated services such as mental health counseling. And that's a big thing. We have a lot of anxiety, depression in the society. It incorporates personal trainers, doctors, nurses, pharmacists, and vets, and the list goes on. So when you have this on your phone, then the next best thing to do is to add AI to it, because what AI would do now is speed up the entire process when you're trying to search for someone. So for example, let me give you the example. If you're in Roxborough, Charlottesville, Scarborough, and you're looking for a gym, you're looking for a personal trainer, you're looking for a doctor, and you're one of these employees, you will be able to use the AI to help you search for it. Now, of course, you could say, well, I can go on Google and do it. But what are the chances of you getting someone who is reputable, someone who can actually do the service you're looking for? So what the AI does is that we have trained the AI to find specific services that we know are respectable practices, especially for when it comes to the healthcare profession. So the impact of it is great. We certainly want to add value to the people of Tobago, people of Trinidad, people of the Caribbean, with respect to getting this digital wellness service. And of course, it will be assisted by AI that has been trained. And that's the important thing. Omni, that's the name of our AI. Omni has been trained in Trinidad and Tobago to be able to respond to the needs of our people.
And how easy is it to use?
When you use WhatsApp, you send a friend a message. Hi, how are you going? What are we doing later? That's it. It's a search bar, and you just type in the question that you have. So you say, I'm looking for a doctor. I'm looking for a wellness provider. I'm looking for a gym in Charlottesville. I'm in Speyside right now. We're not feeling too well. Where's the nearest clinic or hospital? It's as simple as just typing in a search. So there's nothing complicated about it. But it's right now being provided to employees through HRMAT. We are not necessarily there for the, it's not open to the public at this point in time. But once you are an employee, I'm sure your company will be looking to contact HERMAT, Patient Connect, that I represent. And, we can provide the information on it, but it's very cost effective and it's very, very simple to use.
And then what about other services in terms of, diagnosis of health problems, suggestions of treatments and that sort of thing? Is this part of your goal going forward to provide all these services along with that AI?
Yes. So healthcare professionals don't have to worry about, losing their jobs. This is not going to replace anyone's job. This is a support tool to help persons get access to information faster. So yes, the AI can tell you, it's not going to diagnose your condition. It may give you some helpful tips. It may give you some information, resources. It can tell you, how to book an appointment, how, what conditions are similar to what you're saying and that type of thing. But it's not going to make a diagnosis. The diagnosis is left by a doctor. For example, if you have to get a mental health counseling and you type in anxiety, it may give you a couple pointers, maybe take some deep breaths, relax, but certainly contact someone on the app who's dealing with mental health counseling. So in terms of diagnosis and treatment, that's not the role of AI. The role of AI is really to support the healthcare professionals. You do know that since COVID, there's been a major burnout of nurses and doctors and mental health counselors, everyone in the healthcare profession. So this is really here to support them so that we don't get burnt out again for any reason. So it's really a support tool.
And I know that a part of this technology is also monitoring the patients and so on that may be seeking services from the doctors. Tell me a bit more about that.
Yeah, so it's exciting times. When I used to do some health clinics in Tobago, Tobagonians may not have that many diabetics, but a lot of them suffer with high blood pressure. And what we do with the AI is that persons who have the app, they can enter their blood pressure readings daily or their blood sugar readings daily. And the AI will look at the trend, see if it's high, see if it's low over a period of time. And it will actually send you a message saying that your sugar levels have been off. They're not consistent with, the condition that the levels that you want. Same thing with the blood pressure. It will give you this information about the blood pressure. So what we are trying to do is to make what we call remote patient monitoring very accessible to all. And what that does is that it means that instead of having to wait 3 months or 6 months to go back to the doctor to show them these readings, this is being interpreted in real time by the AI, and it's generating a response to you via maybe your WhatsApp, via your email, saying that I don't like these levels, and I think you need to contact the doctor. And we also have members of our health team who will be reaching out to persons who we find, based on the reports that we get from the AI, while they're tracking these sugar levels and pressure levels, we can make that intervention. So early intervention means a better outcome because we could stop you from being admitted to a hospital and then being readmitted to the hospital.
And it can also help with wait times in terms of what you're speaking, because, so some of our elderly folks in particular, they're always in the clinics every week and so on. So that could prevent even like some of the hours that they're sitting there waiting on services.
Well, the intention of telehealth, right? And telehealth was something that we heard about during the pandemic. Now, I have been in the medical profession for over 20 years. And yes, I've used telehealth before COVID. But during COVID, telehealth became huge. And it's not necessarily just talking to the patient, like how we're talking right now. It's not just talking on a video call. One of the utilities of telehealth is what I spoke about, remote patient monitoring your condition at home. Then you have these wearable devices, things that you could wear on your hand, and in real time, we can get information about what's going on with your sugar, your blood pressure, oxygen, breathing patterns, that type of information. For elderly persons waiting in these clinics, sometimes for hours, and I mean, if you're in Trinidad, a lot of traffic, some bad roads to get to the clinics. In Tobago, I think things are a lot better there. It's a smaller place, you have, better roads to access the health centers. But the main thing is that we want to be able to support elderly persons as well in understanding their health better. And we have a lot of health educators on these platforms that would, reach out to persons one-on-one, make a phone call with somebody when they're at home and talk to them about their condition. Tell them, what you're eating today. Have you taken your medication? Are you getting any side effects, any problems? And that is one of the things that we do on the platform. Now, this is not AI driven, but it's one of the tools that we use where a human will contact someone to really just follow up on their condition. So a lot of these services and digital wellness apps, it's definitely something being used now across the world. We have introduced it in Trinidad, Tobago. We are going to Barbados in March, Jamaica thereafter. So we want to make it a regional platform. And in addition to making it a regional platform, this is really the way that we're going to create e-medical tourism, right? You probably heard about medical tourism. People come to countries to go and get medical treatment. People come to Tobago to relax. That is part of medical tourism. The doctor says you need to relax. Go to Tobago, relax on Pigeon Point for a few days. Taking the sun, sea, and so forth. So we're really trying to create that e-medical tourism awareness as well using these platforms. And we really look forward to, what's in store for the rest of this year by introducing these platforms.
And how can people get connected with it? I mean, because from what you're saying, it sounds really great. Something that, especially for those folks that have the elderly people at home, how can they be part of that platform?
Right. So right now we offer it to Hermat, as I said, so they can visit Hermat's website. That's www.hrmatt.com, hermat.com. They can go onto Hermat's website and they can get information there. So once they contact Hermat, the company representative will be able to speak to a Hermat representative and they could introduce it to their employees. As I said, at this point in time, it's not available to the wider public. That is being worked on, but right now it's just through companies for their employees.
And how long before we can see it being open for the wider public?
Well, we are talking to various partners, hoping that they introduce it to the wider public. So I think within the next 6 months, that platform should be available to the wider public. But as I said, it's available to employees at the moment. And if they contact their HR department, the HR department can talk to Hermat, and they could probably try to get it introduced into their company.
All right, great. So Dr. MURADALI, I just want to thank you so much for being on with us and for sharing this wonderful initiative with us. And we certainly wish you best of luck to have it implemented and, more widely used, because this has a lot of benefits, especially for those families who do have those elderly or people who require frequent monitoring of their health conditions and so on.
Thank you very much, Kandace. Thank you very much.
All right, well, viewers, we're going to go for a quick break and we'll be right back right after this.